specific case is always difficult because there's so many really great patients who were able to sort of get back for them to be doing what they do. One that comes to mind is a young woman who had a dog bite to her upper lip. And it was really it was in bad shape. But we were able to sort of put things back together. And it was right before Valentine's Day. And she had healed so much and was so much more whole for Valentine's Day that it was just really sort of a happy experience for everyone involved. It's really nice to sort of help people in distress and then see them over sometimes weeks, sometimes months, and get them back to their normal life. Another sort of gratifying and sometimes sad is breast cancer patients. A lot of times through the course of their disease, we see unfortunately divorces happen, and it's sort of nice to sort of stay with the patient and just get them back to being whole, reconstructing the breast, the areola, and the nipple, and then sort of as they graduate from me, they feel better about themselves and their bodies. After massive weight loss, so people either with bariatric surgery or just losing a lot of weight on their own, they're left with a ton of extra skin. You cannot exercise away the extra skin. So there was a male patient, he had lost weight on his own, and he just had this hanging skin that would get in the way of him doing everything. You can imagine no one likes to lift up literally an apron of skin to sort of participate in their daily activities. So with one outpatient procedure, very routine, we're able to get rid of the vast majority of that extra skin and get him back to his life. I saw him a few times. He was a waiter, and it's just gratifying because he's absolutely thrilled back to his life, and his life has really changed through one surgery. Another amazing thing is going abroad and doing surgery. I've been to Guatemala, and one patient that really sort of stuck with me is a young man, handsome man, but he basically had a growth on his ear. And he came into the office, and it was sort of, he had his hat on and he was a little hunched over. And with what would be the simplest procedure here in the States under local anesthesia, just a little shot of Novocaine, we literally just took off this basic testicle that was hanging from his ear, and to literally see his head sort of stand up and him sort of smile and go about his way with one simple half-hour, 40-minute procedure is remarkable. Another remarkable patient in Guatemala was a woman who was burned on her neck. So her neck was attached to her chest, and with one sort of a large skin grafting procedure, we were able to release her neck, skin graft it, and then literally allow her to pick up her head and walk around and look up again. So a very grateful patient, and she certainly gave me more than I gave her.